HIV, you are a part of me, but you do not control me. Well, when I was 9, they just kind of explained that you have this disease that affects your immune system, and if you get sick, like your brother gets sick, your brother may get well in a day or two, but you may stay sick longer. My family told me that the best thing was to keep it a secret, and so I thought, hey, I can't tell anybody, so I was just like, oh, am I ever gonna find anybody who cares about me and who loves me for me? And it was really like depressing, really. I overcame my depression through seeing a psychologist and a social worker. I can either let this be a negative thing in my life and cry and be depressed in bed all the time, or I can turn this into a positive, and that's when I kind of started doing things more positively, competing in pageants and starting working on a blog called Girl Positive, and just everything positive. That's all I wanted in my life, and I just completely got rid of anything that was negative and that was holding me back. And I am known as a peer advocate liaison, and that's basically working with people who are newly diagnosed or have been diagnosed with HIV and are out of care, and I'm trying to get them in care. Unless you're kind of ready to move forward, you're not really going to. So, but I try to remind them that you have something to live for. Find what you have to live for, because that's what helped me. I found what I had to live for. Well, being pregnant definitely makes me just remember, take your medicine every day, don't forget. I know that the best chance of my child not having HIV is for me to take medicine while I'm pregnant and be undetectable at his birth. So I'm doing everything. I'm going to the prenatal visits. I'm taking my medicine every day. I'm trying to make sure that, he has the best start in life possible. And it's just made me so much more aware of my life and just how grateful I should be. And I know that sounds weird. It's like, oh, you have HIV, but, honestly, sometimes I'm just like, I wouldn't trade it for the world because it's made me who I am. HIV treatment works. Get in care, stay in care, live well.
In 2003, 4, and 5, we had really high runaway increases in our health insurance premiums. It was a big risk factor for us financially that we had little to no control over. So we started exploring alternative ways to finance our health insurance program. Ultimately, in 2007, we launched our wellness program.
If I were to help someone start a wellness program, there are typically few ways to do that. One is just looking at where you're spending your money, your health insurance. The second would be, what are your competitors doing? And then the third is grassroots, is do you have a champion or a committee that really will get in there and shake the bushes and get something started on their own? Our wellness program is successful for 3 reasons. The most important is probably our leadership. They are unyielding when it comes to the support that they provide for us. The second is we have a credentialed team on the ground to serve our people. And the third is we have a very simple plan design. The 5 areas that really drive our health insurance: obesity, tobacco use, cholesterol, blood sugar or blood glucose, we're looking for diabetes, and blood pressure. That's called metabolic syndrome, which is the biggest driver in health insurance.
When we started our program, our expectations were just try to control cost. And it's far outperformed those expectations. We've controlled costs much better than we thought. We've seen our employees buy into the program. We've seen them see it as a benefit, and we are seeing a dollar return for our investment. It's been a great investment for the company.
It was slow getting started. There's been lots of changes since then, but all of them for the better. And when I had my physical, I was overweight, high cholesterol, high blood pressure. At that time, I made the decision, well, I'm going to go strong with this wellness program we got at work and get my health back right. Since then until now, I've lost 90 pounds.
One of the things I really like about the wellness program is how convenient it is. You know, I can go right across the street and have a doctor over there. We have a nutritionist. We have a personal trainer. All these things are very convenient and at my fingertips. I love it. Everything I learn here, I take it to my family, and we all participate.
Of course, when your wife's in it and you're in it, your kids are healthy too. And so it's a whole kind of chain reaction and lifestyle of living healthy. The wellness program has definitely increased my work performance. I've lost 25 pounds, and doing that has made me faster at my job and better at my job. There's so many benefits in the program itself. To lose that, it would be silly.
I have bad cholesterol, let's say that way, and I have a problem with my diabetes, and right now I have everything under control.
It's great to see folks who, when we started, they didn't buy in. They told me that I didn't belong here, I wasn't supposed to be in construction, and now they're our greatest fans. So just to see that shift where they have had good things come from having a wellness program, it's changed their life.
At Nabholz, we consider the value on our investment to be excellent, both in terms of our employee engagement, the money that we've been able to save, and the overall satisfaction of the employees with the program.
Ebola was a devastating disease. The outbreak was unprecedented. Everyone felt like we had to do what we can do. Standing on the side and looking was not acceptable. I lived in Sierra Leone. I am from Sierra Leone, and I felt like I had to do my own little part to contribute to fighting Ebola. I mean, it was a huge task. There was no precedent for it. We had no examples to draw from. This was the first time ever that we had to change behaviors at that level for that period of time. No one wanted to die. A lot of times when we're going into a situation, we're going into a new country, we don't always really understand the culture. It is always very important for us to partner with the communities that we work with, be able to get the kind of information, the kind of support, the kind of buy-in and ownership that would be required for our programs to succeed.
We also had to work with the traditional healers, especially.
There are many ways that we're sharing what we've learned from Ebola.
Questions really started
From the CDC perspective, you have the CDC Museum here, where a lot of people are coming and learning about different experiences. A lot of these are open access information that we're sharing with other people. You know, a lot of the materials and resources that we developed during the Ebola response are all available on CDC's website so that other people can learn from this experience.
You need to identify
some of the mistakes that were made. We can avoid these mistakes in the future if we learn from the past. I was one person working alongside many other people. The biggest takeaway that I got from the Ebola response is the importance of working as a team and doing your own part as if it means the world to you.
Farm will teach you work ethic. I think it also teaches you the facts of life.
I remind my kids it's important to eat right and take care of your body.
I'm a herdsman here. My job basically entails anything to do with the cow side of things. I kind of help coordinate.
He's a cow nerd.
And since I'm the cow nerd, I kind of know the cows. And I always have said that there's a trait that you can just know cows, you know individual cows, you remember these things. This is Lexi, 134 is Lexi, and this is one of the nicest cows on the farm.
We raise our own milk, which is a huge help, especially with 4 kids. And I get stuff out of my garden. We freeze sweet corn in the summer. I put fruit out and the kids eat it. It doesn't need to be in a salad or anything fancy. Just get a banana, get an apple. Keep it simple, and that's kind of what works.
Start cutting the tomatoes.
For lunch, I'm gonna make taco salad. It's one of my kids' favorite. Serve it a lot in the summer because we usually have our own lettuce and tomatoes and cucumbers. It's healthy. I like to add spinach to it because my kids probably wouldn't eat plain spinach, but if I put it all together, it's got cheese in it, so they get a little bit of dairy, and it has ground hamburger. So it's kind of a nice meal in itself.
I love that she cooks every single day. It's not just, oh, here's a bag of chips or here's some money, go get some pizza. A home-cooked meal that we know she prepared, and and it's also delicious.
I think one of the best taco salads you ever made.
I actually try to have dinner ready when they get home from school. I use a lot of crock pot meals. When I grocery shop, I actually go in, kind of see what's on sale to go with our meat and kind of maybe base the meal around that. It is very satisfying when you're eating what you've produced.
Good dinner, Mom.
Good dinner, Mom.
We copy it.
I almost made it. Kids bring it back.
I love having the kids around. It's a weird feeling when they're not around.
I can't make it.
They're pretty good ages right now to help do everything.
It's a good place to grow up.
Doing the physical chores that keeps us active rather than just sitting around. I've seen my plate at school and at different grocery stores.
The gym teachers in school, they focus on that. My plate, look up there, and that's what you should have.
If you want to play sports, then you have to eat healthy. You can't always eat junk food and be a great athlete.
They really are trying to make people more conscious of what they eat.
Yeah, I picked on them the first day we were here. I'm like, oh, you're walking to work now. Yeah.
I like to walk to work. It's what I've always known.
The corn's just coming up. It's beautiful. Against the red barns, it's really quite a view. I think we're pretty fortunate to be here.
Yep, very.
I'm Carol.
And I'm Brad.
And these are our family's healthy eating solutions.
I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Admiral Boris Lushniak, Deputy Surgeon General of the United States. Welcome, Boris.
Great to be here, John.
So even people who may know you from your public role may not know that you're a dermatologist. From that perspective, can you give us some insight into why skin cancer prevention should be such a high public health priority?
Well, certainly. I've been in the public health service now for 27 years, and part of my training is in the field of dermatology. So I kind of bring you this angle of being a clinician at the same time as being a public health official. And from the clinical aspects is realizing that first and foremost, there is an epidemic of skin cancer out there. Each and every year we have over 5 million cases being diagnosed in this country. Cost of treatment over $8 billion. And when you talk about the worst types of skin cancer, the melanoma skin cancers, we have over 65,000 people who are diagnosed each and every year and 9,000 deaths. So I've seen it from a clinical aspect of realizing this is a deadly, perhaps a maiming disease as well. And that it is preventable because so much of the skin cancer that we see in the clinician's office, in the dermatologist's office, comes as a result of ultraviolet radiation exposure.
While you were serving as acting Surgeon General, you released a call to action to prevent skin cancer. Tell us about what is in that and what action steps that translates into.
Well, I think first and foremost, it's really important to realize that the Surgeon General's office has multiple tools, right? We come out with reports, and perhaps the most famous reports are reports on tobacco. We, in fact, when I was acting Surgeon General, issued the 50th anniversary report for tobacco and the issue of smoking in this country and its effect on the public's health. At the same time, although the numbers are somewhat different in terms of the impact on society, certainly as a dermatologist, I felt that we have never really tackled the issue of skin cancer prevention. And a call to action, unlike a Surgeon General's report, is exactly that. Really, precisely looking at those words, it's a call to action. It's for us to put out the science and to say, here's what we know about skin cancer. Here's what we know about skin cancer prevention. And the call to action is really looking at all facets of our society, from the individual level, what can I do to really emphasize prevention of that skin cancer? What can local politicians do? What can industry do? Right? What can big government do? It's a call to action at all those levels, including the clinical aspects, including the scientific aspects, including the research and surveillance aspects. So a call to action really is multi-focused. It goes out there and says, here's what needs to get done to prevent skin cancer in this country.
So thinking about some of those groups, individuals, clinicians, policymakers, what should they be doing to prevent skin cancer?
Well, let's begin at the individual level, right? So at the same time that I kind of say beware of ultraviolet exposure, and a lot of the exposure takes place from sunlight, right? I also send out another message, and that's go out and do things with your body. Go out and be active. So it's not a mismatch of concepts here, right? What I'm not saying is stay indoors and just don't do anything. Really, we have the ability for us to turn into a healthy and fit nation, and one way of doing that is, yes, watching what we eat, but at the same time, it's active living. It's going and walking outdoors. It's enjoying the outdoors. And what I'm telling, through our call to action to the individual level is go and enjoy. But there's ways you can protect yourself from that sun exposure. And it's really basic. It goes back to the ideas prevent tanning and prevent burning of your skin. Although tanning oftentimes is looked at, as a positive cosmetic thing. How many times have you come back from vacation and they say, hey, John, man, you look so relaxed. You're tanned. Look at you, right? Look at you. But the reality is tanning is by definition excessive ultraviolet radiation exposure. Now, that's a strange sort of combination of words, but that in essence is you've exposed yourself to a known carcinogen. And so at the same time that I say go and enjoy the outdoors, but protect yourself. And from an individual level, it's quite simple. If there's shade, seek shade. If you're going to be spending time outdoors, put on the sunscreen, right? Put on the sunscreen of at least a sun protection factor of 15 or higher. Look at it from the perspective of protective clothing. How can I block my skin from this radiation? A wide brim hat, sunglasses, and then enjoy time outdoors. That's at the individual level. If we bring it up a notch, sort of at the policy level, what can we do? Well, to a large extent, it's introducing shade into our outdoor recreational areas. You know, how many times we go to, to see our kids play in outdoor sports, and we're sitting in some bleachers, Little League baseball or other soccer games, and yet we're there baking in the hot sun along with the kids. Reality is you can easily put up shade structures, right? That's policymakers' decision to turn our recreational areas into areas that are protected from this ultraviolet radiation exposure. From the clinical aspect, we again work closely with clinicians, be aware of the diagnosis of skin cancer, be aware that when you're looking at your patient, what things do you need to look for in terms of the signs and symptoms of skin cancer, and refer them as necessary or handle them as necessary. From a bigger scientific aspect, is we have to increase our ability to do great surveillance of skin cancers. Right now, the numbers are all estimates. We have a good handle on what melanoma numbers are in this country because those are reportable. But the other skin cancers, the basal cell cancers and the squamous cell cancers, the non-melanoma cancers are not reportable. And so we really do have to have a more vibrant surveillance system. So those are but three of the aspects that we put out there of saying how we can change our society to be more aware of this known carcinogen, enjoy the outdoors, and protect yourself. The last aspect from a policy perspective is artificial exposure to ultraviolet radiation. And here, yes, I'm talking about tanning booths. In reality, we have a known carcinogen that people are paying money for to expose themselves to. And what I have to be able to do, certainly as the acting Surgeon General and continue to do as the Deputy Surgeon General, is to get the word out that in essence, these are known carcinogens. And we know who's using these tanning booths for the most part. They're young women between the age of 15 and 26 who are out there and who are inducing this tan, excessive ultraviolet exposure, paying for it, and in fact putting themselves at risk. And there are policies that are being looked at from various aspects of state governments, for example, where we're looking at restricting the use of these tanning facilities, for example, for those under the age of 18. So that we do have warnings out there. The Food and Drug Administration has looked at these devices and has put further restrictions on them. That's another one of these aspects of kind of saying we have a known carcinogen, we have both natural exposure through sunlight we have to be aware of, but certainly artificial exposure through tanning booths need to be taken into account here as well.
So that's very interesting. So with indoor tanning, really that's something that can be worked at the policy level, but people may also have in their communities, their academic institutions, their neighborhoods, the ability to have some influence about, opening of these businesses or, other factors as well, making people aware of the risk that's associated with this type of voluntary tanning.
Absolutely, and I think, there's two aspects to this. One of which is, yes, there's regulatory public health. There's the ability to actually provide the information. There's also this aspect from us as public health professionals to make sure we get the right information out. I think there's in many circumstances, the people who are using tanning booths really don't quite understand the risk they're putting themselves at. And I think we need to be better from our public health communication aspect to get the word out, which is, what you're doing there, by inducing this quote unquote pretty tan or this lovely tan, this attractive tan, is in fact doing several things. One of which is putting you at higher risk for skin cancers, but also in the short run, it's putting you at higher risk for wrinkling of the skin. Right? You think you're going to look pretty for the next few years. After that, you keep doing this, the skin toughens up. It gets thicker. It gets wrinkled. You appear older than you should be, when at the same time your goal was to look better.
It's interesting because these sound like actually some of the same arguments and strategies that have proved successful in helping young people smoke less.
Absolutely.
Focusing on these sorts of factors. So can you, to sum up, can you paint us a picture of a future in which we're doing a much better job with skin cancer prevention scientifically and from a policy standpoint?
Well, again, I'm looking at the idea of encouraging people to be outdoors people, right? Of going out and walking with their families, right? Getting into the fitness mode. At the same time, not being paranoid about sunlight, but being aware. Did little Johnny, did little Mabel get the sunscreen on? Did I put the sunscreen on this morning, right? Are we being protecting, right? Protecting ourselves, protective of our children, protecting our children against this exposure, right? It's an awareness and it's the implementation of that at the individual and family level, right? That's sort of what we're trying to achieve. At the same time, that our communities are built around the idea of, for example, being walkable communities, safe areas to walk, walkability. But in the midst of that, where we have recreational facilities, neighborhood pools, places where people are going to be stationary, introduce the concept of shady structures into the design of those areas. It's so much more pleasant sitting around the pool. You get the exercise and all that, but when on a hot summer day, you're in shade as opposed to, as many pools are set up, is nothing but open space. Right? So it's the idea that we have a society that allows for these choices to be made and for ultimately the people to have enough information that they make the right choice. Am I sitting in the sun or am I choosing the shady area? From a further policy perspective, it's looking at a regulatory public health approach and how we deal with tanning beds and the whole industry. There is a lot of similarities, I'll tell you right now, between what's going on there and what we've dealt with tobacco use in this country. And then finally, from a scientific aspect, is for us to be much more robust, for us to realize what are the preventive strategies that work, how do we communicate them with people so people do understand and ultimately make the right choice.
Thank you very much, Admiral Lishniak, for that call to action and for the practical steps associated with it.
It's my pleasure, John.
Please join us next time for Beyond the Data.